Hello. I am a family medicine specialist with 67 years of experience. What I'm about to tell you today is extremely important. Among the fruits that people over 60 often eat without much thought, there are 6 that can be fatal to health. In fact, many of my patients have ended up in the emergency room or had their existing conditions worsen because of these fruits. Especially for those suffering from diabetes, hypertension, and kidney disease, these can be very dangerous. If you don't watch this video until the end, your health could deteriorate seriously. The information I am about to share is based on verified research published in international medical journals. To protect your precious life and health, these are things you absolutely must know. Please press like and subscribe right now. That way, you can continue to receive essential, practical health information. First fruit, grapes. Many people think grapes are good for health, but for people over 60, they can be dangerous. 1 cup of grapes contains about 16 g of sugar, equal to 4 sugar cubes. For people with diabetes, grapes can cause blood sugar to rise rapidly. One of my 68-year-old patients with diabetes ate grapes every day, thinking they were healthy. One day he suddenly lost consciousness and was rushed to the ER. His blood sugar was over 400. Normal is 100 to 140. So it was more than triple. According to the American Diabetes Association, diabetic patients who eat high-sugar fruits like grapes have a 35% higher risk of sharp blood sugar spikes. Fructose in grapes worsens insulin resistance. Grapes also have a glycemic index of 59, considered moderate, but they actually cause large swings in blood sugar that damage blood vessels and accelerate arteriosclerosis. Furthermore, grapes contain salicylic acid, which interferes with blood clotting. Those taking warfarin or other anticoagulants face a higher risk of bleeding. A 70-year-old patient with atrial fibrillation taking warfarin ate grapes regularly and developed frequent nosebleeds and bruising. Second fruit, bananas. Bananas are very high in potassium. 1 banana has about 420 milligrams of potassium. Healthy adults tolerate this, but for those with reduced kidney function, it can be deadly. A 72-year-old woman with chronic kidney disease ate 2 bananas daily for constipation. Within a week she developed a dangerous arrhythmia and was admitted to the ER. Her potassium level was critically high. Kidney disease patients cannot excrete potassium properly, leading to hyperkalemia, which can cause cardiac arrest. The International Society of Nephrology recommends limiting potassium intake to 2,000 milligrams per day for kidney patients. Just 5 bananas exceed that. Stage 3 kidney disease or worse, when kidney function drops below 30%, is especially dangerous. Bananas also have a GI of 60, relatively high. Diabetics may experience rapid spikes in blood sugar. The riper the banana, the more sugar it contains, up to 25% more. Those taking blood pressure medication must also be careful. ACE inhibitors and ARBs increase potassium levels. Combining these drugs with bananas raises the risk of potassium overload. According to the American Heart Association, hypertensive patients who overconsume potassium-rich foods have a 23% higher risk of arrhythmia. Bananas also contain tyramine, which raises blood pressure. For patients on MAO inhibitors, eating bananas can cause dangerous spikes in blood pressure. White right-pointing backhand index safer alternatives. Apples, pears. Third fruit, grapefruit. Grapefruit is known for vitamin C, but for people over 60, especially those on medication, it can be dangerous. It contains furanomerins, which block liver enzymes that break down drugs. As a result, drug blood levels rise dangerously, leading to toxicity. A 66-year-old male patient on statins drank grapefruit juice daily. After 3 weeks, he developed muscle pain and dark urine. He was diagnosed with rhabdomyolysis. The FDA warns grapefruit can increase statin blood levels by up to 15 times, causing muscle and kidney damage. Grapefruit interacts with over 85 medications, including calcium channel blockers, antiarrhythmics, immunosuppressants, antidepressants, anxiolytics, and anticoagulants. Nearly half of these interactions can cause severe adverse effects. The danger lasts long. Grapefruit's effect on enzymes can persist for 24 to 72 hours. White right pointing backhand index safer alternatives. Oranges, tangerines. Fourth fruit. Cherries. Cherries contain plenty of antioxidants but also risks. They have high salicylic acid, similar to aspirin. Patients on aspirin or other anticoagulants who eat many cherries may face serious bleeding risks. A 69-year-old male patient with a history of myocardial infarction on daily aspirin started drinking cherry concentrate for arthritis. Within a month he was hospitalized with gastrointestinal bleeding, his hemoglobin below half normal. Cherries also contain oxalic acid, which can form kidney stones. Patients with kidney problems or a history of stones must avoid them. 1 cup of cherries contains 19 g of sugar, even higher than grapes. Diabetics face rapid spikes in blood sugar. Dried cherries or juice are even worse. Sugar becomes 2 to 3 times more concentrated. According to ADA research, diabetic patients who regularly drank cherry juice had HbA1c levels rise by 0.6%. Cherries also contain tyramine, which raises blood pressure. For hypertensive patients, especially those on MAO inhibitors, cherries can cause dangerous spikes in blood pressure. White right pointing backhand index safer alternatives. Blueberries, strawberries. Fifth fruit. Persimmons. Persimmons contain high tannins, which can form hard gastric stones. Eating them on an empty stomach or in large amounts is risky. A 71-year-old male patient ate 3 persimmons daily for a month and developed severe abdominal pain. CT revealed an egg-sized gastric stone, which required endoscopic surgery. Persimmons also contain very high sugar. One has 25 g sugar, higher than grapes or cherries. Dried persimmons, GOT-GAM, are worse. Sugar is 2 to 3 times more concentrated, equal to 8 sugar cubes. A 67-year-old diabetic patient ate 2 dried persimmons and his blood sugar spiked to 350, more than double normal. Persimmons can also worsen constipation because tannins slow bowel movements and absorb water. White right pointing backhand index safer alternatives. Apples, pears. Sixth fruit. Pineapples. Pineapples contain the enzyme bromelain, which prevents blood clotting. For those on anticoagulants like warfarin or aspirin, this raises bleeding risk. A 65-year-old man with atrial fibrillation on warfarin ate pineapple daily. He developed frequent nosebleeds and bruising. Blood tests showed his bleeding time was more than double normal. According to the Australian Hematology Society, bromelain inhibits platelet function and extends bleeding time by up to 40%. Pineapple is also highly acidic, pH 3.3 to 5.2. For patients with gastritis or ulcers, it irritates the stomach lining. A 69-year-old woman developed acute gastritis after pineapple intake. It can also trigger allergic reactions, mouth, throat swelling, breathing difficulty. A 70-year-old man experienced airway swelling after eating pineapple, requiring ER treatment. Pineapple also contains oxalic acid, increasing kidney stone risk, particularly for those with kidney problems or a history of stones. White right pointing backhand index safer alternatives. Kiwi, melon. Safe fruits and intake guide. Safe fruits, apples, pears, kiwi, strawberries, blueberries, melons. Recommended. 200 g or day, 1 apple. Avoid on empty stomach. Fresh processed juices. Check for drug interactions. Try small amounts first. Seasonal fruits are best. Store properly, discard spoiled parts. Conclusion. The 6 risky fruits for people over 60 are grapes, bananas, grapefruit, cherries, persimmons, and pineapples. Grapes, high sugar, bleeding risk with anticoagulants. Bananas, high potassium, risky for kidney HTN patients. Grapefruit, 85+ drug interactions, toxicity. Cherries, salicylic oxalic acid, bleeding kidney stones. Persimmons, tannins form gastric stones, high sugar. Pineapples, bromelain increases bleeding, acidity harms stomach. This doesn't mean these fruits are absolutely bad, but for people with certain diseases or on medication, they can be very dangerous. Safe alternatives: apples, pears, kiwi, strawberries, blueberries, melon.